Hi, my name is Dr. Michael Corey, and I want to thank you so much for stopping by our peripheral neuropathy page. It's imperative that I get you this information because we truly help our patients with peripheral neuropathy and improving the functions of their physiology. We want to look at you metabolically, we want to look at you also from a neurological standpoint. So I want to give you a little bit more information regarding our program and how we approach your problem with peripheral neuropathy in our office. Now, if you're suffering from peripheral neuropathy, you're probably experiencing some numbness, some burning feet, some cramping, electric sharp pains, pain when walking, difficulty sleeping. You might even have restless leg syndrome, prickling, tingling sensations in the feet, loss of balance. Maybe you've even fallen at this point. Hopefully not, but balance can be very much compromised because you're not feeling your feet. Weakness and swelling. Some of my patients have mentioned that it feels like they're walking on glass or walking on nails. Deep burning sensation. We have to understand that from a neuropathy standpoint, all chronic conditions have some similarities. With neuropathy, this is similar to things that we can see as far as with chronic fatigue syndrome, rheumatoid arthritis, migraine headache sufferers, chronic neck and low back pain sufferers as well. These commonalities that we can see are primarily evolving around metabolic imbalances, meaning that we're looking at anemias, we're looking at unstable blood sugar, we're looking at adrenal function, hormonal imbalances, loss of oxygenation, hypoxia, chronic inflammation, toxicity is a big one. We've all been exposed from our environment to so many different bacteria, virus, xenotoxins, herbicides, pesticides. I mean, all of these things can affect you and cause your nervous system not to work efficiently. So, and most importantly is a decreased frequency of firing. We want to see that the frequency of firing of your nerve impulse from your brain down to your feet is sustained and is adequate to provide oxygenation and circulation and blood supply to get down to those feet. So it's imperative that we can help correct that. Metabolism is when you eat food, you get energy, and the energy is produced so that we can have a full functioning nervous system and sending and receiving information from our brain to our organs and tissues, and most importantly with neuropathy, your feet again. If you have a metabolic problem, your brain will not work right because your brain is the most metabolically active organ in your whole system. Of course it is, because it's the most important one as far as what dictates the functions of every muscle, cell, and tissue of our body. Now, these stresses, chemical stresses, physical stresses, emotional stresses, and stresses in general from toxicity and so forth can all cause the brain to fatigue. This means you get fewer nerve impulses to tissues and organs and back to the brain again. So we want to activate this. Now, all neurological cases, including peripheral neuropathy, are a combination of neurological problems and metabolic problems. So when we look at the issues with peripheral neuropathy, we have to understand that the nerve activation, those muscles, tissues, organs, joints, ligaments, and so forth that are sending signals to the brain, hit the cerebellum, which is housed in the back. It controls your postural muscles, the arches of your feet, the curves in your neck and your low back. That signal's got to go through continuously, and we have to make sure that we open that pathway if you are having compromise. So if you have degenerative joint disease and if you've got disc issues, then we need to evaluate you in that area. We're also going to look at cortisol levels with inflammation, oxygen deficits, blood sugar, hormone, and midbrain issues. Now, midbrain is where you get most of your sensation from your peripheral nervous system back up to the brain. We want to evaluate that. But we're going to bring all those pieces down together. And we're going to make sure that all those pieces are together so that we can make sure that we can get you well. Now, I have a couple questions for all patients when you consult with me. On a scale from 1 to 10, how serious is your illness? Are you experiencing those symptoms that I just reviewed with you? How has it affected your relationships, your work, your ability to enjoy your life, to play sports, to pick up your grandkids, to walk across the floor without having pain? It's all about quality of life, and I want to make sure that we can enhance that and improve your condition. On a scale of 1 through 10, how serious are you about eliminating your illness? And due to time constraints, I have to mention that we are a busy office, and I want to make sure that you are very, very serious if you do decide to come to our office and consult. I want to make sure that we resolve the issues. Now, I've done some things. We got a special report. I also have a DVD that we can forward to you, or we can send you the link. All you have to do is fill out the the information to the right of the screen here, and we'll forward that to you immediately. But I am here for you. We want to make sure that we get you well. And so if you're ready to tackle this and take control of the causes of your neuropathy, complete the form to the right of the screen over here, and we'll send you the free video and report, and you can request the evaluation, or you can call our office directly at 714-730-5833. Sincerely from my heart, I want to make sure that we can help get you well. And I'm more than happy to give you a consultation on the phone if that's what you would like prior to coming in. So I'm Dr. Michael Corey. Thank you so much for watching, and I look forward to helping you.